Thank you, Mr. Turner. Mr. Conley?
Thank you, Mr. Chairman. And I would yield to the distinguished ranking member of the committee if he wishes to.
Thank you very much. I want to thank the gentleman for yielding. I want to discuss what a conviction for marijuana possession, no matter how small, means for most individuals across the country. With a conviction, a person loses the right to vote, federal financial aid and public housing assistance. Conviction erodes employment opportunities and future earning potential. And I can tell you that I live in a neighborhood where The Wire was filmed. And so I see a lot of young men who have basically been sentenced to a life term of not being able to move as a normal citizen would in this society. Deputy Director, let me ask you this. Isn't it true that convictions for even minor nonviolent drug possession have a significant negative effect on an individual, their families, community, and the nation? Would you agree with that?
I would, sir. And by way of context, when Director Kurlikowski took this position, Director Kurlikowski is the Director of Office of National Drug Control Policy, former police chief in Buffalo and Seattle, took this position. He clearly articulated that we cannot arrest our way out of the problem. That what we need to do is really have a robust strategy, reflecting on our strategy of prevention, intervention, and treatment, and a series of criminal justice reforms that does everything we can to divert people away from the criminal justice problem. And I can tell you, I was in Massachusetts at the time as the director, and it really signaled to me an important shift in drug policy, away from a war on drugs approach, and really looking at this as a public health-related issue, particularly as it relates to the racial and ethnic disparities that we see as it relates to drug use. Part of the role of our office is to also look at what are the impediments for those people in recovery like me who often do have criminal records, and what does that impairment mean in terms of their ability to have a vibrant life in the community and seek meaningful employment and meaningful housing. And so to that end, we've been focusing on actions to diminish those barriers. So clearly those issues are important to us. I think you will find that they're reflected in our strategy in making sure that we are not dealing with this just as a public safety issue, but how we think about prevention, treatment, recovery support, and again, looking at smart criminal justice reforms to make sure that we are not incarcerating people for low-level nonviolent offenders. I think, as you know, Department of Justice has been supporting many states' efforts around justice reinvestment and are clearly understanding, both from an economic perspective and a humane perspective, we can't continue to incarcerate our way out of the—
Well, let me ask you this. What is your— so how do you all interact, that is ONDCP, with the Justice Department? Because and with regard to when you got some states saying recreational drugs, you can purchase them, and then most states saying you go to jail. I mean, so how do you all? And I think that that's what what this hearing was trying to get to. I mean, where are we going with that? Because it just seems so incredibly unfair that you would have a situation, and like I said, I see people that are affected by these laws every day. On the other hand, I am also concerned, very much so, and Mr. Michael, remember when he and I were involved in the Criminal Justice Subcommittee, we both are very concerned about the effects of marijuana. So how do you all try to strike that balance?
I would say, Representative, that that's the entire position of our strategy, that it's not kind of war on drugs, arrest people, send them to jail on one hand, and quite honestly legalize as the silver bullet to our problem. that we believe in a much more balanced and middle-of-the-road approach that deals with this as a public health-related issue. So, and the primary way that we do that is by setting the administration's national drug control strategy. And you know, obviously that's sent and transmitted to Congress, and a big portion of that is really about smart criminal justice and innovative criminal justice reforms that look at not incarcerating people, not arresting people for low-level violent use, but making sure that folks have access to a wide variety of public health interventions too.
And I just want to make sure you're clear. It's just not the incarceration. You're right. I mean, when a person gets a record, they are doomed for life. So it's just not the incarceration. I see my time is up, Mr. Chairman. Thank you.
Would the chairman just allow me
Go right ahead.
to, if the distinguished ranking member would yield?
Of course.
You and I have worked together on problems involving the ability of people to cast a vote. And to your very last point, Mr. Cummings, is it not true that among the things that affects them for life, it can also affect their ability to participate in the electoral system?
Claim my time, yes.
I thank the chair.
Okay. Well, Mr. Botticelli, you are the Deputy Director of the Office of National Drug Control Policy. That office is under the White House, right? Now, when the President said, where's the statement here? He said, I don't think, referring to marijuana is more dangerous than alcohol. What was your reaction?
I think the administration's policy has been consistent as it relates to.
But he is the chief executive, and the office that you're in, it was set up under the White House to report to the President. You just got through saying that it is dangerous. We continue to spend resources to try to stop children and others. You also said since the beginning of 2007 to most recent statistics, we've seen an increase in adolescent use and abuse. Then the President said it's important that we go forward. He was speaking of legalization because it's important for society not to have a situation where a large portion of people have at one time broken the law and only a select few are punished. I mean, this is in conflict with what you were using taxpayer dollars to try to avoid. You just got through also testifying 314,000, is that in treatment for marijuana, which is only surpassed by alcohol and abuse, is that correct?
That's correct.
So we have more youth, which is there anybody here that wants to legalize this for adolescents? I don't think so, but we're getting more hooked, and the President comes out with this statement. I'm afraid, too, you know, we've gone from just say no, and then we had I didn't inhale, and then now it's just say maybe or just go ahead. And it does concern me because our youth are the most impressionable. I was asking our staff, because when I was there, I remember turning to a political consultant, a little bit controversial, but one of the best in the business, Dick Morris. And I'd worked on some campaigns with him, and I said, and Dick Morris, I believe, lost his brother to substance abuse. And Dick was convinced that the way to change public opinion was with ads and you can change public opinions in that regard. And that's where we launched some of our ads. We originally were trying to get the media, which is about as slack as you can get in putting up ads, even though we control the airwaves and they're supposed to be free. But then I think the deal we cut with Clinton was to have half paid and half donated time. Are we still doing those ads?
So
to influence public opinion in young people, you have ads. Now we have emails. We have Twitter and texting and a whole host of social medias. Are we paying taxpayer money to use those techniques, which are supposed to be the most effective, to try to curtail? Again, I think we'd start with adolescents. Sure. Adults are one thing, but adolescents. are we doing that?
Our office has been administering the Above the Influence campaign, which uses a wide variety of largely social media techniques.
Have we dropped going after marijuana? Have we dropped going after marijuana? Do we have any ads on marijuana? I mean, we've done a great job on tobacco, particularly in the last few years.
Correct.
But what about marijuana?
So I've been doing prevention work for a long time for a wide variety of areas. I actually, in Massachusetts, tobacco control was under my authority as well as substance use. And I think what we know in terms of prevention science is that often we have to focus on providing youth with resiliency skills to resist a wide variety of substances.
But you're not answering my question. Is the United States of America under the Office of National Drug Control Policy or any of the program, do we have any programs that you're aware of that are advertising to change the behavior of adolescents in regard to marijuana today?
Yes, we are.
We are.
As that program.
Maybe you could provide us with some copies. I'd like to see what we're doing.
Sure.
Because the law is going in a different way in some of the states. I mean, we haven't even gotten into the conflict using law enforcement resources. Mr. Turner just talked about them coming in, raiding Federal authorities in states which have now taken measures and other people have taken advantage of. But I'm concerned, again, the trend with young people. I'm not sure where we're going to go with this whole thing. I have my own opinions. I was talking with Mr. Conley. He has his. There's the medical marijuana use issues. There's the recreational use. There's the legalization use. But I think we have the most schizophrenic policy I've ever seen as far as dealing with a social issue, and again with laws that are in conflict with public spending, which is in great conflict.
So one of the things that I can say, both in terms of the public information campaign that we've been running, as well as our drug-free communities programs that have both had independent evaluations in their success, that with our drug-free coalitions and through independent evaluation of our Above the Influence campaign, that we've been able to make significant progress, that we have evidence of effectiveness of a wide variety of our prevention programs. And I agree, I think many of those strategies were adapted from tobacco campaign programs in terms of how you provide those messages to youth.
Well, again, we've had some successes, but I don't know exactly how much money we've been spending. We're going to find that out for the record. You're going to provide it to the committee. It doesn't sound like we've had much success. You just testified actually increase in some of those categories. Got large number in treatment. Then sort of the icing on the cake is, by the way, our new health care will cover it, so don't worry, you're covered for treatment. Once you get to treatment, you're pretty bad off. Let me ask you a quick question. Mr. Cummings and I chaired the subcommittee. Everyone we had come before us said that marijuana is a gateway drug. Most people who go to the other harder drugs end up or start up with marijuana. Is that still the case, or has that changed? They're going straight to other drugs now?
So let me respond to a number of questions that you've raised here. So first and foremost, if you look at a wide variety of drug use indicators in the United States, that we have made significant progress in many areas. We've seen reductions in youth use of alcohol. We've seen reductions in cocaine. We've seen recent reductions in prescription drug use. So I think we've seen that and those are direct areas of focus for our national drug control policy.
I met with my local police officers last week for breakfast, and they told me two things. They said it's not getting any better. I mean, it looks like that some of the deaths have dropped, but they said that's only because they've got better treatment. They're catching them, but actually the incidents are up, and they shift from drugs. It's now because of this, there isn't much risk. It's socially acceptable go to marijuana, but the kids are also the adult population too is shifting back to methamphetamines and prescription drugs, as you know, a spiral misuse of them has spiraled out of control.
But your point in terms of the increase in terms of marijuana use, I think is particularly important. And if you talk to Dr. Nora Volkow, who is the director of the National Institute on Drug Abuse, kind of the preeminent researcher in this area, we support most of the world's major research as it relates to drug and drug-related issues. She will tell you that, prevention science tells us that when people see things as less risky, think of yourself and your own behavior, that you're more likely to do it. One of the reasons why we've had success with tobacco is kids see it as risky. And unfortunately, kids no longer see, the vast majority of kids no longer see marijuana as risky. So it's no surprise,
after the president's statement, too, when he said it's no different than alcohol. Again, we have the D here. I'm only reciting what others have said. The DEA chief, one of their chiefs said he viewed last Wednesday, I guess it was called the legalization of marijuana at the state level, reckless and irresponsible, warning that the movement to decriminalize the sale of pot in the United States will have serious consequences. Do you agree or disagree with that?
Again, the administration position has not changed as it relates to legalization.
So you agree what he says?
The president has indicated that this is a public health challenge and that we need to deal with it as a public health challenge.
Well, again, the president may, I didn't start this. The president made his comments. And now you have different agencies, including yourself, under the president saying something different than what we're hearing in some quarters. So with that, let me go. Mr. Day, you haven't asked questions. I'm sorry, Mr. Conley, because you yielded.
Thank you, Mr. Chairman. Welcome, Mr. Botticelli.
Thank you.
And let me just say I've enjoyed your paintings for many years. Thank you very much.
I wish I could say that I inherited any of that.
I know, I couldn't resist. Are you from Massachusetts, by the way, originally?
I am from
Where?
Massachusetts. I lived outside of Boston in Malden, Massachusetts.
Malden. I'm from Brighton and Alston.
Oh, you are?
And I can talk like that if I have to.
My first apartment was on Comm Avenue.
All right. Well, glad to have you here. To this point about the president's statement, holding in abeyance whether he should have made it or what he intended from it. How many people die from marijuana overdoses every year?
Mm-hmm. I don't know that. I know it's very rare for someone.
Very rare.
Yep.
Now, just contrast that. Prescription drugs, unintentional deaths from prescription drugs. One American dies every 19 minutes. Nothing comparable in marijuana. Is that correct?
Correct.
Alcohol. Hundreds of thousands of people die every year from alcohol-related deaths. Automobiles, liver disease, esophageal cancers, blood poisoning from too much toxicity from alcohol. Is that not correct?
But
Mr. Botticelli, is that correct?
I think the way that you have to look at this is that the totality of harm that's associated with a substance, and to basically say that because marijuana doesn't have the lethality and the overdose potential that heroin or alcohol does, diminishes, I think, the significant health consequences that are associated with the drug.
Well, I guess I'm sticking with the president, the head of your administration, who was making a different point. And he was making a point that is empirically true. That isn't a normative statement that marijuana is good or bad, but he was contrasting it with alcohol. And empirically, he's correct, is he not?
I think the point here is that the administration's position has not changed.
Mr. Botticelli, I'm not asking you that question.
And that when you look at alcohol and substance use, that we have to look, or marijuana, that we have to look at this as a public health related issue. So, I have to say this morning,
Mr. Botticelli, excuse me, no. I'm asking the questions here, Mr. Botticelli, and I'm directing you to answer them. If you want to add your opinion, fine. But is it not a scientific fact that there's nothing comparable with marijuana? And I'm not saying it's good or bad, but when we look at deaths and illnesses, alcohol, other hard drugs are certainly, even prescription drugs, are a threat to public health in a way that just isolated marijuana is not. Mm-hmm. Isn't that a scientific fact? Or do you dispute that fact?
No, no, I don't dispute that fact.
Okay.
But may I continue?
Well, just a second. I hear bric-a-brats being thrown at the President as if he did something reckless. And my view is he was trying to put this in perspective, because there are states that have decided to go down a different path. And my friends on the other side of the aisle are all for states' rights when it comes to guns or gay marriage or other things. But apparently in this case, states have no business getting in the drug business. And yet I look at the war on drugs, and let me ask you this question. It looks to me like public opinion has shifted profoundly. 20 states and the District of Columbia now allow marijuana to be used for medical purposes, and 2 states by law in referendum just voted to legalize, regulate, and tax the recreational use of marijuana. That's almost half the country. It seems to me, and then if you look at polling, in 1969, when the war on drugs began under Richard Nixon, only 12% of the population supported legalizing marijuana. That same percentage today is 52%. That's a huge change in public opinion. Given all of the efforts, again, as the Chairman said, just say no under Nancy Reagan and all kinds of PSAs on television and radio and newspaper, and trying to make sure that we highlighted how dangerous drug use of any kind could be, why do you think public opinion has shifted so dramatically on the issue of marijuana?
Again, from my standpoint, and I'll speak candidly, that I am not sure the public is getting a fair and accurate view, particularly as it relates to the public health consequences of marijuana. I think that it's been portrayed as a benign substance. I don't think that they fully understand or have gotten information to really understand the magnitude of the issue. So, I think that that's part of the issue. When, clearly, and we've seen this with other substances, we've seen this with prescription drug abuse, that when people see something that is legal, when they see it, that it's often prescribed by a physician, people see it as benign and not harmful. And so it's not a surprise for me to see that change in public perception.
Well, all right, let me pick up on the point you're making. First of all, this whole issue of, is it a gateway drug? Is there empirical evidence that, in fact, it is a gateway drug? Can we empirically correlate the use of marijuana to then moving on to other more dangerous substances?
So we know that the earlier that someone, and particularly in adolescence, uses marijuana, the more likely they are to develop a dependence and go on to more significant issues. So, and if you look at those folks who have an opiate disorder, prescription drugs, or heroin, they will often tell you, and you will often see, that they started with early tobacco, early alcohol, and early marijuana use. But
Mr. Botticelli, wait a minute. That's a logical fallacy. Yes, that's true, but that begs the question of the fact that millions of Americans, Mr. Blumenauer, I think, cited 50 million, have used marijuana, and they didn't go on to all those other drugs. So we have to disaggregate the addictive personality from the recreational occasional user. And again, I mean nothing normative by this. I already said in my opening statement, I'm a child of the 60s. I'm extremely leery of legalizing any drugs. I've seen the damage. But I want us to be basing, the fact of the matter is the war on drugs doesn't look like it worked very well in public opinion, in demand, whereas other campaigns that cited tobacco that are voluntary, actually have worked. And so maybe we could learn something from that, as opposed to incarcerating, especially minority populations in this country. And that doesn't seem to have worked either. It doesn't seem to have reduced demand.
Representative Connolly, so I think just focusing on marijuana as a gateway drug obviates the total harms associated with substance. We know many people who use alcohol and get into problems and they don't have an addictive disorder, but that doesn't mean that there's not harms associated with use. And the same is true with marijuana, that we know about 1 in 9 people who use marijuana go on to develop a dependency. But we also know that there are health consequences associated with marijuana use in general, and particularly with adolescents and young adults. So, again, National Institute of drug abuse has shown that youth brain is in development up until 25 years of age, and that regular substance use, including marijuana use, can have significant long-term effects. We're not talking about folks who gateway to other drugs, but we're talking about just marijuana use in general. So I think you really have to look at not just those people who go on to develop addictive disorders. Yes, we need to be concerned about that, but you really have to look at the totality of harm. Think about the number of people who use marijuana and get in fatal car accidents. They may not have an addictive disorder, but clearly their marijuana use has had significant health consequences for them.
My time is long up, and I thank the Chair for his indulgence. I would just say, though, the problem with that logic is it takes us exactly where we are today. So it fills up our prisons, even when it's really a small amount of possession, and where the effect is we treat somebody no different than if they committed a violent crime. And those inequities in our prison system are the consequence of treating marijuana exactly the way you just described it.
I think under this administration, we've really tried to move away from that war on drugs and arresting and incarcerating. So this is where we believe that there's a balanced approach here, not legalization that has some of the attendant public health consequences to it, and not a war on drugs approach, but really looking at dealing with this as a public health related issue and utilizing criminal justice reforms to make sure that we're not arresting and incarcerating. So our policy really and our position really focuses on that middle ground in terms of both innovative criminal justice reforms and dealing with this as a public health related issue.
Arresting and incarcerating, I wish Mr. Cummings had stayed, but let me yield to the gentleman from Illinois, Mr. Davis.
Thank you very much, Mr. Director. I think you partially answered the question, because as we continue this discussion, could you refresh for me just what the purpose and mission of the Office on Drug Control Policy is?
Sure. So again, we were established by Congress in 1988 with the authority of really setting the administration's national drug control strategy. We produce that strategy, we send it to Congress every year, and it really is a blueprint, an interagency blueprint for how one, the administration is going to handle drug-related issues, and really looking at this whole-of-government approach to how we're dealing. So each agency has a role to play, as well as looking at their budgets and making sure that they are aligning their budgets with those drug control strategy. So it sets the administration's drug control policy. It looks at strategic priorities. It looks at interagency cooperation and interagency action as it relates to how they are going to implement those drug control strategies.
Do you make recommendations to agencies and to Congress and to the public in general?
The express purpose of our strategy is really to look at how the federal government is going to respond and what is our policy related, and how other agencies align their work with those policies.
We've just heard a great deal of discussion relative to disparities among population groups relative to arrest and the judicial process. Would the agency have any position on any of that, or would it have any recommendations based upon what we've just heard about disparities in arrest and the judicial process?
Sure. You know, when you look at our strategy, and this was set in the original 2009 Obama administration strategy, again, it really focuses on a wide variety of criminal justice reforms to look at that, about how we make sure that we're diverting people from the criminal justice system. You know, one of the things that we've been really promoting, again, with the Bureau of Justice Assistance, is the expansion of drug courts in the United States. So we now have 2,700 drug courts in the United States that are diverting people away from incarceration and giving them treatment along with accountability of those issues. You know, we have been also, again, focusing on things like diminishing the barriers for people to get jobs. We've also been focusing on smart probation efforts. So we have been trying to implement a wide variety of innovative criminal justice programs that really look at moving people away from the criminal justice system. I think the other piece, too, is looking at these public health strategies of prevention and early intervention. The goal of those is to not only intervene early, but really minimize the chances that people are going to intersect with the criminal justice system. You know, often we have not dealt with these issues early, and so we want to make sure that we're preventing those issues from happening. So that's been part of our policy position in terms of how do we come up with alternatives to incarceration, particularly for folks with substance use disorders.
Would you see legalization perhaps as an asset in terms of the reduction of need for drug courts?
Mm-hmm. Again, I don't see that. We don't see that as an effect when we look at legalization. Again, I think that our concerns around legalization is that we'll see an increase in problematic use, and we might need more drug courts if we move down the legalization pathway to do that. So I don't think that it diminishes the need for those kinds of services, and might have actually an opposite effect in terms of greater impact and greater need both within our treatment system and within some of our criminal justice programs like drug courts.
Thank you very much. I yield back, Mr. Chairman.
Thank you, and let me yield now to Mr. Blumenauer.
Thank you again, Mr. Chairman. I really appreciate this, and I've found the conversation here to be very useful, and I think you're highlighting the wide range of issues that are on people's minds. I hope there's an opportunity to continue it. Mr. Botticelli, how many marijuana overdose deaths were there in the most recent year you have available?
To my knowledge, I don't know if there have been instances of specific overdose-related
deaths. No, you
deaths.
talked about marijuana deaths, and so I want to be clear. I'm trying to trap you.
No.
How many marijuana deaths have there been in the last 5 years?
So if you're referring to overdoses, I am not sure of those numbers. If you're referring to fatalities,
then I would like to have you supply us with how many overdose deaths there were, because I have heard from experts whose judgment I respect that they don't know of any. So that would be really important for you to provide, at least to me, if not to the committee. What is more dangerous and addictive, methamphetamines and cocaine or marijuana?
So, I don't think anyone would dispute the fact that there's relative toxicity related to those drugs. But I'm afraid,
what's more dangerous and what is more addictive? Cocaine and meth or marijuana? Pretty simple.
I think that conversation minimizes the harm.
No, I'm not trying to minimize the harm. I want to know which is more dangerous and addictive.
Again, I go back as
a
public health person. One of the things that we look at is not what's the relative risk of one drug.
Okay.
Against
Let me just
another.
say that I think that your equivocation right there, being unable to answer something clearly and definitively when there is unquestioned evidence to the contrary, is why young people don't believe the propaganda, why they think it's benign. If a professional like you cannot answer clearly that meth is more dangerous than marijuana, which every kid on the street knows, which every parent knows, if you can't answer that, maybe that's why we're failing to educate people about the dangers. I don't want kids smoking marijuana. I agree with the chairman. But if the deputy director of the Office of Drug Policy can't answer that question, how do you expect high school kids to take you seriously?
So, Representative, I didn't mean to be disrespectful, and I didn't mean to indicate that there is not different degrees of toxicity associated with different
I asked
drugs.
what was more dangerous. You couldn't answer it.
No.
And I just want to say that you, sir, represent what's part of the problem. Let me go a little further.
So, sir, that's
Let's
exactly
talk
not
about
what I'm saying.
What kills more people, tobacco or marijuana?
There's been a fair amount of tobacco-associated deaths. My challenge, and the reason I'm hesitating about answering the questions as it relates to relative risk, is I think many times that conversation gets distorted, that there's no risk, that there's...
I'm not trying to trap you.
No. But this is why, Representative, I don't want to be disrespectful.
Let me suggest that your inability to answer me whether tobacco or marijuana is more dangerous, again, is part of the problem. Mr. Connolly documented very clearly that we have been able to drop dramatically tobacco use. And it kills more people than marijuana, if you don't know that. But we've been able to drop that without locking people up, without arresting. I think this administration has seen 3 to 4 million people arrested for marijuana since it's been in office. And yet we've been able to drop tobacco use without being coercive. We've been using fact-based advertising, and we've focused our efforts on things that matter rather than things that don't work. And I'd respectfully suggest that you and the department take a step back if you're concerned that somehow people think marijuana is benign. That part of the reason is that drug professionals can't communicate in ways that the rest of America does. I appreciate your being here, and I welcome any written follow-up to my questions. Because I'm not trying to trap you, but I'm very discouraged by your inability to answer questions.
So let me tell you, this morning I spent the bulk of my morning with a number of parents from across the country who are doing everything they can do to prevent drug use, and particularly prescription drug use, and many of them whose kids have died of an overdose. And I asked them, what more can the federal government be doing in terms of preventing substance use and preventing the tragedies? And they told me they cannot understand why states are moving to medical marijuana and legal medical marijuana. They cannot understand it because they understand from a very acute level the message that legalization sends them. And so this is not from a bureaucrat in Washington. These are from parents who struggle on a daily basis and have been devastated by addiction and their kids. And they understand in a very dramatic and real way that legalizing marijuana sends the absolute wrong message to our youth.
I think the gentleman will recognize Mr. Cohen from Tennessee.
Thank you, Mr. Chair. With all due respect, you should be listening to scientists. I understand the parents who are grieved because their child died of an overdose. They didn't overdose on marijuana. And you're listening to them rather than the scientists? Mr. Botticelli, it may go back to A Few Good Men, the movie, Jack Nicholson. You can't handle the truth. The truth is the drug war failed. Your direction on marijuana is a failure. Get to dealing and saving kids from heroin overdoses. My young 22-year-old friend died of a heroin overdose. Yeah, he smoked marijuana, probably the first thing he did. But that's not why he smoked heroin or shot it up. Maybe he did it because he heard people like you saying they're all bad and they're all terrible and you can't deal with the truth, and tell them, well, maybe marijuana doesn't kill you. Heroin does and meth does. They're different. And until you deal with the truth, the kids aren't going to believe you at all. Now, you talked about alcohol, and you may have gotten to this. Cirrhosis of the liver, pretty serious thing. Violence against spouses and women. People don't smoke marijuana and beat up their wives and girlfriends. They get drunk Sometimes they beat up their wives and girlfriends. And I know you've got your statistics. I would debate your statistics. And if you get into your statistics about the amount of people who had marijuana in their system who were arrested or had fatal accidents, I would submit they probably had other drugs in their system, like cocaine or crack in addition to the marijuana, or they had alcohol and marijuana wasn't the cause. Because what I've understand is people smoke marijuana, mostly they drive slower and they look out for the cops. They don't drive fast and wild like people do on alcohol and cause deaths. Maybe the reason there's so many more people smoking marijuana now is because they're not listening. And maybe they're doing the other drugs too. But it also shows that the drug war has been a failure. It's been a serious failure. Harry Anslinger started. You know who Harry Anslinger is, don't you?
I do not, unfortunately.
You never? Well, you should, because he's your great-grandfather. He started this war in the 30s, and he was tuned out too. And he did it to get the American public had problems, which sometimes I think we still got them, with Hispanics and Mexicans coming into this country. And it was a war on Hispanics and African Americans. And that's when they made marijuana illegal, was in the 30s. And it was all directed at those people. And Latinos are just as much discriminated against as African Americans in disparate arrests. It still continues to this day. It's 85 years since Anslinger started this. And it's the fact that we spent so much time arresting people is sinful. You talked about the overall effects of marijuana. Again, you can't name one person who's died from an overdose of marijuana, can you?
Not to my knowledge, sir.
Right. And you say the cumulative effects. Do you know people, possibly, or heard of people who smoke marijuana who are corporate giants, run banks, run major corporations? Do you know about these people?
Yes, sir, but I also know equal number of people. I know a substantial number of people who also have gone on to develop significant disorders who have smoked marijuana. Again, 1 in 9 people who try marijuana develop a dependency, and we know that particularly those kids who use it earlier in their
Kids shouldn't use it. Kids shouldn't use it ever. And at age 18, people shouldn't be arrested for it. Mm-hmm. Maybe it should be 21. But kids shouldn't use it. That's something we all agree on. But the fact is, we need to put our priorities toward heroin and meth. What percentage of your budget goes towards heroin addiction?
So I don't think we necessarily slice our budget, our demand reduction budget, based on drugs. Again, our prevention efforts are focused on preventing drug use.
Isn't that a mistake when people die from heroin in great numbers that the Vermont governor spends his entire state of the state on heroin use? And we don't distinguish and try to save people's lives? That's when you knock people over at the corner store. It's not to get money to buy a donut because you're high. It's to buy heroin because you're hooked. Mm-hmm. That causes people to die.
Our office in 2011, I think, acknowledged the burgeoning prescription drug and opiate epidemic that we have in the United States. In 2011, we released a plan that looks at dealing with the prescription drug abuse and opiate issues.
Let me ask you, my time's about to run out, and it may have. Let me ask you one thing. I corresponded back in 2011 with I guess your predecessor, Kierliowski?
Kurlikowski. He is actually the current director now.
Is he? He said back then that there was no particular, they haven't found any medical use. To date, however, the FDA and the Institute of Medicine have not found smoked marijuana to be a safe or effective medicine for any condition, nor has any medical association came out in favor of smoked marijuana for widespread medical use. I think that medical associations have, but are you not aware of the fact that people use smoked marijuana to get them through cancer treatment, nausea?
I do, sir, and it's never been our office's position to either to arrest people who've been using medical marijuana. I think it's important for us, and again, unfortunately, that the FDA is not here. You know, that it's the FDA process that ultimately determines the scientific efficacy of a.
But couldn't you try to influence it? Shouldn't that be part of your job? I had a buddy who was a SEAL. He died of pancreatic cancer. So when he was he smoked marijuana at the end. His mother said it's the only thing that makes oral smile or eat. So that was pretty good.
So our role in this is to rely on the FDA scientific process to determine. That's our influencing role, is to rely on the science. I would also say, and I find it unfortunate, and I think I would ask the chairman to invite Dr. Nora Volkow, who's the director of the National Institute on Drug Abuse, because that's where our policy and our science is derived from. We are a science-based office and a policy-based office. And I think if you listen to Dr. Volkow, who is not involved in a political discussion around substance use and marijuana, she will lay out for you the scientific evidence that.
Well, let me ask you this. You are prohibited by law from using any funds to study marijuana legalization for medicinal purposes or any other reason. You're the only office in the federal government that's restricted in that way, and you're required to oppose any scheduling of Schedule I substances, rescheduling like marijuana, that have been approved for medical purposes. Aren't you troubled by these constraints, and don't you think that your expertise should be allowed to be used in study science and contribute to a positive classification of drugs?
So I'm not familiar. Congress put that language in our reauthorization, and I'm actually not, I don't know the background of that.
Would you support legislation to allow you to participate and to voice your opinion and to use science as a basis for your determination?
Well, what I would do is support that federal agencies have the ability to do that. So
yours is prohibited by law. Should that restriction not be lifted?
Again, I think we'd have to have subsequent conversation in terms of.
You mean you think you should be muzzled?
I think that it's important that our office not involve itself in terms of given legislation or given activities. And I believe that that was the genesis for that language, that the office not involve itself in state.
But the totality of the drug world, you need to participate. And if you realize that medical marijuana, as 20 states have found, can help people with cancer, with nausea, with those maybe glaucoma. I mean, Montel Williams apparently has some benefits from it. Lots of people do. That you should be able to participate and set our drug policy straight. Mm-hmm. Your job should be to have a sane drug policy, not to be muzzled and handcuffed.
Yeah. From again, my standpoint, I'm happy to engage in fuller conversation, is that has not handcuffed other offices and other federal agencies who are tasked with that work from investigating.
In 1971, Congress created a commission that was headed by Governor Schaefer of Pennsylvania to study federal marijuana policy. That commission came out in favor of decriminalization, but it wasn't put in place. That was 1971. Would you support a new commission to study federal marijuana policy?
So I haven't seen that legislation. I'd be happy to have further conversation.
Would you? It's a concept.
Again, I think we'd be happy to have a conversation in terms of what that might look like.
Thank you, sir, and I yield back the balance of my time.
Well, I thank the gentleman, and we will have additional questions. Some members weren't able to attend today, and we didn't get some responses from the witnesses that we would like to have for the record. So without objection, we'll leave the record open for a period of 2 weeks. We'll also be submitting to you, Mr. Botticelli, some questions we'll ask for a written response. Again, I think this is our first hearing. We may have a series. You've suggested additional witnesses, and we're going to try to work with the minority too, and witnesses that they request. I think this is a very serious issue, and it shows a great conflict between federal, state, local laws, and huge amounts of money that we are spending at the federal level raises a host of issues about enforcement, about education and prevention programs, and other worthwhile efforts that we have to try to keep substance abuse under control. So with that, again, I appreciate your coming out today, being part of this hearing. There being no further business before the Subcommittee on Government Operations, this hearing